as you can appreciate, there are nuances here, distinctions between a person's social capacity and pragmatic daily functioning. Okay? So social interaction isolation really speaks to motivational impairment, which is an important consideration, and then looking at diagnostic congruence. So the degree to which a person's social withdrawal and poor social engagement can be directly tied to the diagnosis. So we know that for major depression, something like social withdrawal, anhedonia, loss of pleasure, and loss of interest pertaining to social interactions can all occur. So we're looking to the degree to which their social withdrawal can be explained by and is directly tied to the diagnosis. So of course, an easier way to kind of explain this potential dilemma is somebody for whom we're considering having strictly a chronic pain disorder. Okay, so basically this individual is presenting as withdrawn and not socially engaged. They have a level of pain. But here we're asking the question, to what extent is their social withdrawal due to incapacity because of the pain disorder versus more or less a lifestyle the person has fallen into? Because they don't have the structure any longer of getting up and going to work, they're sitting in the basement playing video games, watching TV on Netflix, and the like. So that's a distinction that's really critical that has to be made. So certainly in terms of, we have to look at diagnostic congruity and the degree to which the diagnosis can explain it. Again, collateral evidence is really important here to understand what the family member is understanding about what's going on here. Is it just the person's kind of taken on this TV or internet or Netflix addiction, so to speak? Or is there other evidence that they have really withdrawn because of pathology? So maybe we can have a bit of a discussion around this point. So are folks feeling that it's an easy distinction to make? Do you have any techniques that help you to make those distinctions typically? Any strategies? Because one's kind of more suggestive of potential malingering, or as I say, maybe somebody who's kind of fallen into a certain lifestyle of inactivity post-accident versus pathology. So and I'll entertain, you don't have to be Paul to ask. I think it's a fair open discussion because it does really cut across for all of us. Whether you're an orthopedic surgeon, a neurologist, a chiropractor, and it goes across, it's beyond CAT. I mean, it's an important consideration that we all have to look into and consider. So what tools do you bring to the table when you're trying to make the distinction between whether a person can do but isn't versus can't do? What are some of the clinical things you look for? What are some of the tools that people look to?
Psychological diagnosis.
Okay.
That could explain the behavior.
Yes. Mm-hmm. Certainly. So a physical person might be looking to, for that on file, for example, or asking a colleague that's been involved from the psychiatric, psychological perspective. Okay. Any other? Want to chime in, Paul? Have I picked any too much?
No, I'm sidetracked actually.
Oh, sorry, okay. So just from the psychologist's perspective, what kind of questions to ask, tools do you use to determine whether someone's kind of fallen into a lifestyle of social withdrawal and activity versus a true pathology that's reflective of social withdrawal?
What type of measures?
Could be measures or techniques, tools. How do you go about making that judgment? Since we have to comment on social functioning, that's the main kind of differential functional diagnosis, if you like. So what would you look to determine whether the person's lack of social engagement is truly grounded in pathology versus a lifestyle they've fallen into?
Well, if I'm thinking about depression, for example, I'd be relying on psychometric measures of depression to look for strong indications of anhedonia, lack of energy, things like that. I would rely on class to see, you know, is this person the same person they were before the accident in terms of their ability to react to pleasurable stimuli, et cetera, et cetera? Do they have the same energy level, the same? So those are two things.
Great.
that we look at.
Okay. Anybody want to add anything to that? Another is the OT's data. Yeah, if the OT, and again, this is for, yeah, the OT can certainly be asking these kinds of questions, but I mean, I think a hallmark here is to what extent is that person actually deriving pleasure from the alternate activity, from the movie watching, from the sitting in the basement playing video games, or whatever else they're doing. Because if you speak to somebody who's truly depressed, even if they're downstairs maybe playing a little bit of video games, what's your experience in terms of?
They're just going through the motions.
Right, right, exactly. Even in terms of watching TV or whatever, they're probably not even really paying attention to the movie a lot of time. But somebody it's a lifestyle thing, they're probably having a darn good time. And they'll probably readily tell you that. And their significant other will oftentimes readily know that as well.